using MDMA and psilocybin. MAPS, the Multidisciplinary Association for Psychedelic Studies, is a nonprofit with ongoing research on using MDMA to treat PTSD. The organization's website, maps.org, states that researchers have found that MDMA can increase trust and compassion, making it an ideal tool for PTSD treatment. Their website also mentions involvement in other psychedelic studies, such as psilocybin for anxiety in cancer patients, LSD for illness-related anxiety, and ayahuasca for PTSD and drug addiction. Without a doubt, organizations like MAPS should be able to continue their work. However, citizens are just as deserving of this right to explore their options and benefits. If a U.S. citizen chooses, he should be allowed to experiment with these drugs, especially if using them to treat symptoms of a disease, for example, cancer. Any citizen, suffering or not, undeniably deserves the right to choose. However, I think most people can agree that someone sick or dying unquestionably should have access to whatever options they seek, no matter the assumed risks. For the government to deny this is wrong. It's becoming more and more widely known that psychedelics and other drugs are being studied for their positive benefits. Just as organizations can experiment with these substances, so should citizens, without prosecution. We've talked about our right to pursue happiness, the hypocrisy of legal alcohol and tobacco, and finally, even some possible benefits of illegal drugs. All of these things considered, I see no logical reason for the continued illegal status of these drugs. The status of psilocybin, MDMA, LSD, and ayahuasca is unjustified, considering our basic rights, the legality of harmful alcohol and tobacco, and the benefits of uses being researched. The harmful effects of alcohol and tobacco compared to the even potential benefits of LSD, MDMA, psilocybin, and similar substances should already create doubt in your mind towards the validity of current drug laws. Even if you don't agree yet, I want to mention a few ways you can get involved if you do. The first would be to get involved with groups that advocate for drug policy changes. One of these is Students for Sensible Drug Policies, who advocate for large-scale drug policy reform based on evidence, compassion, and human rights. Another more direct way to get involved would be to write your senators with your feelings on the subject. And lastly, the easiest way to make a difference is starting small by informing yourself and the people around you on the wrongfulness of current drug policies.